I want to introduce to you the trauma series, which contains 4 different workshops from 3 hours. In each workshop where we highlight a specific, let's say, a consequence or a specific element which is linked, specifically linked to trauma. The first one is trauma and anger. And I'm going to start with some different features of trauma therapy, and then look theoretically about what can we consider as anger, what is anger, and differs from aggression, anger also, and PTSD. We're going to look at which are the sources of anger, and then I'm going to propose my anger model, in which we have those different systems which can be on the basis of this manifestation of anger in the client. Then in the second part, it's about treatment. And we are going to, I'm going to teach you all kinds of exercises and things you can do, and also how you can recognize and which system is responsible for the anger manifestation. We are going to talk also about anger and shame, anger and dissociation, and also anger and grief. Then in the second workshop, it's about trauma and anxiety. It's so important to understand that always anxiety is linked to trauma. You can't imagine that there's no trauma without anxiety. So it's a very important workshop to deal and try to deal with how you are going to work with your client, which is, as I consider, in a kind of chronic anxious state. So we're going to look at also the neurobiology of anxiety from the brain side, and all those subtypes also of anxiety. And then again in the second part, it's about the treatment. I'm going to tell a little bit about the phase model of trauma treatment and about the stabilization phase. We're going to work on 4 levels in this treatment of trauma, of anxiety and trauma: the neurobiological level, about affect regulation, about the cognition and the body, and then also a little word about how to go to resilience and how to work with dignity and also hope in this. And then the third one is about invisible attachment trauma, because I really want to highlight a specific form of attachment trauma, which is a little unknown, but in my opinion really is a hidden epidemic. And it's about, I'm going to emphasize this, and also I'm going to explain what I mean about invisible attachment trauma, which is about disruptions in the attachment relationship between the child and the caregiver. And I'm going to talk about the ghosts in the nursery. This means this unresolved traumatic experiences from the parents, and also when the parents have this lack of capability to help their children to regulate their internal states, their emotions, their stress. And also I'm going to highlight the consequences of invisible attachment trauma, which are really very severe. And then I'm going, the second part, it's about also dissociation and what we consider dissociation in the child, also in the adult, and also the neurobiology of dissociation. And then also going to guide you through some treatment guidelines, how to work with invisible attachment trauma. And at last, not at least, is about trauma and suicide. And I'm going to make a distinction between the death wish and suicidal ideation. Also the connection between early childhood trauma and suicide, which is dependable upon the experiences of the child, that they have been abandoned. I'm going to talk about disorganized attachment disorganized attachment style, which is also on the basis or a result of attachment trauma and other trauma, attachment trauma, dissociation, and also this pathways which is leading you towards suicidality. And the second part, I'm going to propose two cases and how we have been treated those two cases of it's a child and an adolescent to work with this suicide ideation and their death wish that was in the client.